Hi everyone, we have Dr. Kishore Kumar here with us today, a leading hand therapist here in Chennai. With over 16 years of clinical experience, he has a wide knowledge on all upper limb and hand conditions. So we're very glad to have you here with us today, sir.
Thank you, thank you.
So before we go into the interview, sir, how are you, sir, doing?
Yeah, I'm fine, I'm fine. How are
sir.
you?
Fine, sir. Thank you so much. So, I would like to ask you some few questions.
Sure.
Okay, sir. So, what was the reason that you started the Manuszeal Healthcare Academy, sir?
So, I started the Manuszeal Healthcare Academy on October 2021. So, and the major mission is to disseminate knowledge across the globe from experts in healthcare to physiotherapy professionals as well as physiotherapy students, to enrich their knowledge in advancements in healthcare. So that is the mission. So my vision is to attain global excellence in rehabilitation services for the patient, and also for the education in physiotherapy, to go to the next level of advancement in rehabilitation care from experts across the globe in healthcare, from all specialities in healthcare.
Okay, sir.
Yeah.
So why hand rehabilitation, sir?
So,
what made you go take that?
Yeah, actually I graduated from my UG in physiotherapy in the year 2006. So after that I worked in a hand specialty hospital in Chennai, Right Hospitals in Chennai. So from there I developed that passion immediately after finishing my graduation. I can see the sufferings of the patient, especially in the hand rehabilitation, because most of the cases, if you take road traffic accidents, so 40 to 50% of road traffic accidents involve the hand injury. And if you see the sufferings of the patient, when compared to other injuries such as shoulder or elbow, for example, you take, or knee injuries or any other part of the body, if any other joint gets injured other than the hand, the disability is less when compared to the hand, because if the hand is involved in any injury, what happens is directly it affects his ADL. That is, ADL is activities of daily living. So he can't feed himself, he can't dress up himself, he can't involve in any other ADL activity like brushing activity, or any other self-care activity will be affected rather than the other injuries. So it directly involves the hand in self-care activities. So the sufferings of the patient will be more, my opinion, will be more, and it's very important as it deals with the day-to-day activities. And the patient will be more of psychologically affected due to this injuries. So one thing, this is the thing, and when you see the in the rehabilitation aspect, the hand therapists are very less when compared to other specialty physiotherapists. Hand therapists are very less in India. So if you see on the perspective clinically, the patients, as I told you, 40 to 50% involve the hand injuries. But the therapists who are rehabilitating the patients, hand injury patients, are very less, because hand specialty is not being taken as a specialty in the masters nowadays. Before 15 years, there was hand specialty in the postgraduate course, Masters of Physiotherapy in Hand Conditions. Now it is taken from most of the institutions from the curriculum. So that also made me to take hand as a specialty, and my special interest also, my self-interest also. And I want to make sure, my vision is to make sure that the patients suffering from hand injuries will be rehabilitated equally when compared to other injuries. That's why I took the hand specialty, and I hope in future generations I can, and my team can motivate other students from the root level, that they can cultivate and I can make the spark in the hand rehabilitation studies, and they can take it as a specialty, and they can practice in day-to-day life with the patients for rehabilitating the patients.
Okay, sir. So you were here for the workshop today with us, sir. What was your experience? How did you feel about it?
Yeah, it was great. Actually, I must thank the principal, Dr. C.V. Sindilnathan sir, very kind of him, and he is very always thinking about the welfare of the students. So, of the students of the college, and always his visionary is to enrich these students with advanced knowledge. So, he gave me the opportunity for this hand rehabilitation workshop, and very much thankful to him, and also I am thankful to the management of M.G.R. Dr. M.G.R. Educational and Research Institute for the opportunity, and all of the supporting staffs who were backing up me throughout this today's workshop very well, and all the other people who were behind the screens. Thank you, thanks a lot.
Thank you so much, sir. It was a great honor having you here with us, sir.
Thank you
all so much.
Thank you, thanks a lot.